So we don't usually talk about prostate health. We usually wait until something bad happens or until someone gets older. But as a provider, I vow to do better because we know now that prostate health is something to work on as early as your 20s. But what is even the point of a prostate? The prostate's main function is to produce a fluid that makes up semen, along with other fluid and sperm from the testicles. For all my fellas out there who want to have children, and even if you don't, you need to make sure your prostate is on point at all times. Unfortunately, one of the most common conditions that I'm seeing more often now that is affecting the prostate is BPH, also known as benign prostatic hyperplasia. So it used to only affect older men, so we think. But there are so many younger men dealing with it too now. And who's to say that that problem doesn't actually start when you're younger? I mean, who would know if we aren't even checking for it until our men turn 40 to 45 years old? But either way, there are too many men being affected by this condition for us to not pay attention to it. It's the fourth most common diagnosis in older men, and potentially 90% of men will have an enlarged prostate by the time they are 80 years old. I've been looking deeper into this condition over the past couple of weeks because it's something that I want to kind of teach my son about in the near future so we can prevent it, before it actually becomes a problem. And even though science acts like it doesn't know where it comes from, you don't have to wait until they get the answers. It's not something you have to live with because I'm going to tell you exactly how you can lower your risk with naturopathy. So if we are looking at BPH from a naturopathic perspective and a functional medicine perspective, it is possibly due to hormonal changes like an imbalance of DHT and estrogen, increased cellular growth factors, genetics, having diabetes, metabolic syndrome, being obese, chronic inflammation, and oxidative stress. And do you want to know where most of those factors come from? The simple lifestyle choices that you are making may actually be increasing your risk of prostate inflammation, cancer, and swelling. This is going to include stress, which may increase DHT and estrogen levels and can stimulate prostate cell growth and increase inflammation. Lack of exercise because it may contribute to obesity, metabolic syndrome, and diabetes, all risk factors for prostate enlargement, by the way. Sedentariness can also reduce circulation, potentially allowing toxins to accumulate in your tissues and then promote inflammation. A poor diet, fatty, greasy, and processed foods, that's going to lead to obesity, increased inflammation, reduce your antioxidants, and then disrupt your hormonal imbalance, which will affect your prostate health. And also inhaling toxins from weed and tobacco. That's going to introduce harmful substances, increase oxidative stress, and contribute to chronic inflammation, and then potentially disrupt your hormones. Poor sleep habits, not recovering during the important hours of 10 p.m. and 3 a.m. is going to disturb your hormones, increase your stress, and increase your inflammation, all while impairing the way your cells repair and regenerate itself. And how many of those things are outside of our control? None of them. All of those can be changed. So now let's talk natural solutions for prostate health. So whether you do or don't have prostate issues, you can start better lifestyle choices today to lower your risk of prostate issues in the future. Also, if you are a man, old or young, you can utilize herbs and nutrients to protect your prostate from now too. Herbs to help reduce your prostate inflammation and the symptoms of weak stream, like too much peeing at night and going too often, are saw palmetto, pygeum, and stinging nettle root. Foods that you can eat to protect your prostate from inflammation are berries, watermelon, pumpkin seeds, and algae oil. And to protect the prostate, you can also make sure you are getting enough zinc, vitamin D, and selenium-rich foods, but if not, consider a supplement that contains all of those things. Listen, now that you know all of this, I don't want to hear about any of y'all in the doctor's office with this issue. No excuses. Remember, you are in control of your health. You just need to do the work. Give thanks.